Support comes from Thomas Nelson Community College, now becoming Virginia Peninsula Community College, the first choice to start a career. Gain skills in fields like cybersecurity and education. More at tncc.edu.
Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.
Good afternoon, everyone. I'm Barbara Ham-Lee. As we enter into the 2021 holiday season, the coronavirus pandemic is still very much with us. With the Delta variant of the virus causes most hospitalizations in the country, the Omicron variant is spreading rapidly. Scientists are still trying to figure out the impact of this latest version of COVID-19, but we do know that although symptoms seem to be milder, it is much more contagious than other variants. Up next on Another View, cardiologist and health equity director Dr. Keith Newby with the latest on the Omicron variant. Stay tuned. Another View will be right back after this national, regional, and local news from NPR and WHRO News.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Ham-Lee. Another View listeners, you never ever let us down. And we are so incredibly grateful. You know, last week was our fall membership drive, and Another View had a $2,000 challenge, which meant that every dollar up to $2,000 would be matched. Well, you guys came through and we raised $6,355. Yes. Thank you. On behalf of Todd Washburn and Lisa Godley and myself, we are so very grateful for all of your support. We want to thank Kelly Jackson and Dr. Renee and Escafre Torres and John Torres, Virginia Tum and David Mayfield, Michael Harrison, Carol Mickens, Martha Mitchell, Stephen Smith, Patricia Murphy, Diane Ween, Kenneth and Cheryl Eisenbeis, and William and Renee Byrne, and also Velma Brown, who is Lisa's aunt. And we want to say thank you, Aunt Honey. We truly appreciate it. You all are just awesome folks, and we are so grateful and thank you for the kind notes that you sent about the show. We are humbled and we are grateful. And if you still would like to contribute, if you didn't get a chance to give us a call last week, it's not too late. 1-800-940-7170. That's the number to call. Tell them you're calling in support of Another View. So, have you changed your plans for the holidays now that we're dealing with the new strain of COVID-19 called Omicron? Are you still planning on traveling? Has the new variant made you rethink your decision about getting vaccinated? How serious is Omicron, and how should we protect ourselves? So many questions. And here with some of the answers is cardiologist and health equity director for Sentara, Dr. Keith Newby, one of our favorites. Hello, Dr. Newby.
And how are you doing today, Bob?
I'm doing just fine. Thank you so much, because I know last month we told you that you had a break until after the first of the year, but that was before Omicron
I know.
reared its ugly head.
Well, firstly, anything for you, I will do. So that's the first thing right off the bat. Congratulations on your fundraising campaign.
Thank you very much.
I'm not surprised even remotely. Secondly, this is important stuff, and again, you know how I am about this vaccine. Yeah. And I'm going to continue to keep pushing the envelope. And, if you need me for any of this type of thing, I'm always be there, because I'm tired of seeing our people dying out here.
Absolutely. So, you know what? We reached a grim milestone this week. More than 800,000 people in the United States have died of COVID. That's 1,200 people die each day, most among unvaccinated and the elderly. and more Americans died in 2021 than in 2020. And now we have Omicron. Keith, what do we have to do to get people to understand how serious this is?
Well, I tell you, unfortunately, so I think we still. Well, the quick answer is continuously, discussing this.
Yeah.
I think, unfortunately, so we still have a bunch of people who have no idea about what they're talking about out here, saying things that are wrong. Mm-hmm. And I think that's still ongoing, and unfortunately, so with the disjointed message that you hear, 1 week is this, 1 week is that, and it flips around, it goes around in a circle. I think the kind of the take home message is, despite what you hear, get vaccinated.
Exactly.
That is the take home message. I mean, don't even worry about the rest. To me, just protect yourself and get vaccinated. I think those are the two key take home messages.
Absolutely. And, and you're right. There is conflicting information. I was listening to a story on NPR. I believe it was yesterday, as a matter of fact. And a woman was talking about, home nurses going into homes to help people who have COVID-19. And the patient said, even though she was suffering from COVID-19 at that moment, she still would not get a shot.
What else do you say to that? I mean, it's just, and I don't, for the life of me, I can't figure it out. I mean, I lived COVID-19 all the time for the last 2 years, and I've seen the misery that it causes. I've seen the deaths that it causes, and why people have got this craw to make the vaccine worse than the disease, I do not know. I can tell you firsthand that is not the case. Yeah. Firsthand. But for some reason, and that's why I really want politicians and media people, meaning like the celebrities type people who want to say stuff that they don't know what they're talking about. Mm-hmm. I really wish that they would just let the people who are expert at medical conditions stake the claim about what needs to be done. And unfortunately so, because they say First Amendment right, whatever it is, I can't first, second, whatever it is, about free speech. Unfortunately so, it's hard to sway people to say, listen, just listen to the experts and stay away from the rest of it. But unfortunately so, that's a hard thing to do these days. So
what's up with Omicron? I mean, we do know it may be spreading faster, but what else do we know?
Well, one of the things we're still in this process of understanding. The one thing I try to tell people is, and I can't remember if I mentioned this on your show before, but virus's only job is to survive. That's its job. Take over a host and survive. That's the only thing it's designed to do. Oh. So when you talk about trying to, why does it mutate? Because it's trying to survive. As your body builds antibodies towards something, it says, okay, I need to figure out how to get around this. So it flips itself, and part of this process anyway, as it replicates, there's going to be some DNA structures that change. So some of the mutation is that, and some of it is this ability to want to survive. So you have those two things that you're dealing with. So that's what a mutation is. Unfortunately, so some of the mutation is in the spike protein that the vaccine is targeting. Now, despite that, they still say it appears, based on all the early data, that it is still effective. But that, I think the little snippet that was played right before we came on the air when it was talking about the number of viral particles, look at it like an army that you're trying to fight. So if your army is, say, you had, 1,000 people in your army, and you're fighting another army that has 10,000 people, of course, that's going to be a lot more, that's going to be a harder task to meet, to be able to win, versus if you had an even army or if the other army was smaller. So when you talk about more viral particles, look at that like that army's bigger. So that's why the vaccination stuff is important, because you want to build your army, and you can't build it without having that vaccination. So if you're talking about the viral particle mass is going to be so prominent so quickly, it's going to be hard for your body to catch up. That's why I tell people your health is important. Like how healthy you are is definitely important, but that can't be the only thing, because despite how healthy you are, if your body's never seen COVID before,
it's not going to be ready to fight it.
It's not going to be ready. It can't be. I mean, just statistically, and even if you've had COVID before, you know, just like anything else. I mean, look at it like you ever see fighters that when they in the off season they kind of get a little chunky looking,
yeah,
you know, because
they stop working out.
They stop working out, so they're not going to be able to move as fast as when they're in their most tip top shape. So look at when you've been exposed to COVID, or if you had the first couple of shots, but it's been months and months and months, and your body's not seen COVID, it's not going to be ready, because it's gotten like the chunky dude that's sitting around. I mean, you know, we have to stay in shape. So we have to stay in shape physically, but we also have to stay in shape from our antibody response, which is why the booster is so important.
So, Keith, when we talk about Delta variant being the thing that causes you to go to the hospital the most right now, and it's still the most prevalent, and Omicron is, you know, spreading rapidly and all of that, are there differences in the way that you are sick or the symptoms that you experience, or should people look at it as it's still COVID-19? Period.
It's still COVID-19.
You know, stop. This is what's going to happen. Yeah.
It's still COVID-19. You know, it's just a matter of again, how it affects it. And, you know, and it affects different people differently. Yeah. You know, because, you know, and we know even with the original strain, the Delta strain, I mean, even though the only thing that we were looking at was how infectious it was, but the actual what it causes still varies from person to person. The one thing I'm trying to get people to be careful about is that comment that you hear about, Omicron is not that bad in terms of it.
Yeah, I was going to say, we need to put that whole idea of milder symptoms in perspective.
Yes. Yeah, I mean, because, and the other thing is, a lot of those people who have those milder symptoms were vaccinated people.
Yeah.
You know, so that's one thing. But to me, I don't want COVID, period.
Yes.
You know, I mean, you know, this thing, it's not that bad. So I just go out here with no mask, and if I get it, I'll just blow it off. The problem is you don't know that that's going to be the case. That's the part about COVID that makes me antsy, is that it's unpredictable. You don't know how you will respond to it. You can have an idea. But I had a good dear friend of mine pass away a couple months ago from COVID-19 that would not take the vaccine, but it had no medical problems, none, you know, and he died of COVID-19. So the fact, and he worked out a lot, you know, I mean, he wasn't like a marathon runner, but he was clearly in shape. He wasn't overweight, had no other medical conditions. And he died of COVID-19. So, again, that's what I'm trying to tell people. Don't let the hype fool you. You know, you don't want COVID, period.
Yeah, because just because if your cousin gets a mild case of it, that doesn't mean that that's how you're going to experience it.
Exactly.
440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. What questions do you have for Dr. Newby about how to navigate through the holidays, knowing that we are still in the midst of this pandemic? 440-2665 or 1-800-940-2240. So with all the talk about Omicron being much more contagious and spreading so rapidly and so forth, Dr. Newby, were you surprised that the Chesapeake School Board voted to end the mask mandate in Chesapeake Public Schools?
Yes, I was to a large degree, because, I mean, I know, unfortunately, so a lot of this stuff is political, I'm convinced, because it's not going on the recommendations right now. I mean, you got this escalating potential virus. Now, we've been fortunate in Virginia right now in that we're not seeing, like I'm not seeing that escalation currently in the hospital just yet.
Mm-hmm.
But, it's kind of like, I'll give you a prime example. I did this Zoom show last night, and we talked about gun violence, and I had Chief Boone up there from Norfolk Chief of Police, and he was making this comment about in other cities where they get a gun intervention program that seems to work, and all of a sudden you see the violence start to decline. City councils then pull that funding, because they say, "Oh, you don't need it anymore." But then all of a sudden it's going to start escalating back up because the intervention was pulled too early. For me personally, right now, especially, we're going into the winter months. So we know just by definition, flu viruses, cold viruses, all escalate in winter months. Why? Because of closed conditions. People are not outside, they're inside. So why pull a mask mandate when the potential for spreading viruses are at its peak? I just don't understand. I mean, to me, if you've gone this long, why not finish out the year?
Yeah.
I don't get that, and nothing they could tell me would make me understand that.
Yeah, it's supposed to go into effect January 3rd when everybody comes back after the holidays.
But listen, and it's even worse because then you're going to be spreading it all over the place because you're going to be at a family event. Somebody's going to have it. Somebody's going to get it, and then you go back to school. Yeah,
because they're calling for a surge. They're thinking that, according to the CDC, that the surge over the holidays is going to happen because people, for that very reason, people are coming together. So as you're thinking about your holiday plans in general, do you advise people, especially if they're going to visit grandma, older aunts, uncles, older relatives, should we just stay away or is it okay to mask up and, or should you just go take your chances?
Well, I just think if everyone's vaccinated, I think you can have some comfort. Okay. But would I let my guard down? No. Because think about it, and I tell people all the time, see, I'm trifling. I ain't going to lie. I ain't trying to be around anybody. My family's going to fuss at me a little bit this year because my job is to protect other people. And because I have a higher exposure because I work in a hospital, you just can't avoid it, the potentials. I know the relative risk is going to be higher, so my job is to protect my family, first and foremost. My mom's 92. Close to being 92. And why would I take that risk with her? Now, she's been fully vaccinated and booster.
Right.
And that's great, but we still know the potential. But because she is at that age range, she has other medical conditions, I have to be diligent to make sure that I don't infect her because I don't want that on my conscious that I did something that took my mom's life earlier.
And that is such a good point. I mean, talk about the personal responsibility that we should assume so that we don't infect others. Because, a lot of times you hear all the rhetoric about, you can't tell me what to do and take away my rights and, and so forth. But what about protecting other people?
Well, see, we have become the society. It's all about me. It's not about it. It's not about you. It's about me. It's my rights, me. This is what we have, unfortunately. So, I mean, I'm trying to make it a little bit light because it's such a bad subject to even have to go through. You have to do something to make it so it's not so bad. And that's the issue is trying to get people to understand that personal responsibility, that it's not about you. It's about who you affect. And are you okay with that? If you tell me you're okay with hurting somebody else, I don't want you around me. I mean, I'm just keeping it real. I don't want you around me. You can go on down the street somewhere and hang out all you want to, But if you're going to, and because I care about people, that's why I went to this business I'm in, because I love people and I love helping people if I can. And if I can't, I'm going to do my best with it, which means I have a personal responsibility to do what I can to help others and protect others.
So our phone lines are lit up. So if you're trying to call in and you get a busy signal, keep calling 440-2665 or 1-800-940-2240. Melissa joins us from Hampton. Hi, Melissa. You on the air?
Yes. Am I actually live?
Yes, ma'am. You sure are.
Okay. Well, my question is this. Maybe I have a statement and a question, but I know several of my family members that actually took that vaccine, and after they took it, within 2 weeks to a month, they died. So I don't believe in the vaccine. However, I do believe that we should be protecting ourselves in different manners. Now, I don't understand why people are not talking about diet. I don't understand why people are not talking about the mental strain that this is causing on the environment. But taking that vaccine is not for everyone or not for anyone at all when we are just being lab racked and tested on. When I know for a fact that my friends and my family members have been dying from taking the actual vaccine.
Okay, we will let Dr. Newby respond to you. Melissa, thanks so much for the call. We appreciate it.
All right. Well, Melissa, I can only say this. We've vaccinated in my office probably close to 5,000 people. We've not had one death. So the question would be is whether or not your family actually died of the vaccine or something else. Because that's going to be a little interesting to say that, because, I mean, if you look at the death rates of vaccinations, they're like dirt low, just globally. So I've been vaccinated 3 times, and Barbara, you've been vaccinated 3 times.
Sure
my
have.
whole family, including my mom, and everybody in my family has been vaccinated 3 times, and we've had no deaths, no nothing, no complications. So I can only say what I know based on experience. And I do believe, and I mentioned earlier that, that individuals, I believe the vaccine is for everybody personally. Mm-hmm. And I can go on facts and data to prove my point. Now, when you look at, this issue of, other medical conditions, like I've had people say they don't want to do the vaccine because they have other medical conditions. Well, those are the ones that need the vaccine most because they're at the highest risk. Now, I mentioned earlier about, you should be healthy. Mm-hmm. You should be healthy. You should be eating properly. You should be exercising and doing the things that's going to keep your immune response at its best. But most people don't do that anyway. Mm-hmm. But you should do that, and I think that's important. But again, your army has to be built. I think this issue of we've villainized vaccines inappropriately because, again, if you look at the true data, I would challenge anybody to show me and be able to prove to me that somebody actually died of the vaccine itself and not other medical conditions that would have led to their death, regardless of whether or not they've been vaccinated or not.
And her point about the mental health piece of it, too. I mean, we recognize, just as you were talking about taking care of your physical body, you also need to take care of your mental health through this because it's been tough. People don't like to be isolated. And
I agree. I agree. But to me, the very first thing that we have to do is protect ourselves from getting disease.
Absolutely. Let's take another call. Kim joins us from Chesapeake. Hi, Kim. You're on the air.
Hi, yes. My question was pertaining to the home testing kit.
Mm-hmm.
With the new variant, do they pick up the new variant as well, or is it just for the original Delta variant?
Well, no, it's still a coronavirus, regardless. So still COVID-19 is just a variant of that. The only difference is part of the spike protein that's there. The issue with the home kits, and you just have to be aware of this, is the home kits are going to be positive or negative based on the amount of viral load that you have. So that's why they have those PCR tests and the antigen tests. The antigen tests are looking for people who have active infection and at a certain level. So their actual antigens or the amount of viral particles have to be above a certain level to show a positive test. So say you're early and that's why they kind of don't recommend testing too early, because you haven't had the opportunity to create an increased viral load that would allow that test to show positive. So if you have symptoms of COVID-19, or you think you may have, and you do a home test, and of course, if it's positive, you're done. But if it's negative, that does not necessarily mean you don't have COVID-19. It just depends on where in the process you are. That's why they recommend don't test but so early. You're looking at 4 or 5 days down the road. Of course, that's when that test is going to give you a more accurate result. So you just have to be careful with that.
The reason why I ask is because, I've got several people that I'm around that have apparently tested positive with the home kit for COVID. But I myself am not, systematic. I don't have any symptoms whatsoever. But when would I know that it would be time to take one of those tests? I don't want to get around loved ones and, then get symptoms or not get symptoms at all and not have tested.
Let me ask you this. Have you, were you vaccinated? You don't mind me asking?
Absolutely. Yeah, I've been vaccinated.
So, that's going to put you in a better category. I personally would say if you're totally asymptomatic and you're masked up, I wouldn't even necessarily recommend testing right this second. I would just wait. If you start to develop symptoms, if you're keeping yourself protected, you're doing your social distancing and you're wearing your mask around others, you are, by definition, protecting other people anyway. So, I would probably wait on the testing and just see if you start developing symptoms. These individuals you were around, you say they were positive for COVID, are they like very symptomatic or stuff at home and quarantining and all that kind of thing?
They are now. They tested for it just because they were a little under the weather, and if they have any other symptoms, they tested positive, and then within a day or two, got a fever and so forth.
Yeah. If I were you, now if you don't develop symptoms and you really feel like you want to get the test, I would wait probably 4 or 5 days from the time of potential exposure, and I would go to I wouldn't necessarily do the home test if you're asymptomatic, because that may give you a false sense of security. You may want to go to like one of the urgent care places that do PCR testing, and that will give you a more accurate look at whether or not you actually are positive or not, because you can be asymptomatic and have COVID-19, especially a fully vaccinated person. So if you're, but I think masking up, your social distancing, all the things that you're supposed to be doing anyway. Wait till that 4 or 5 day mark, and if you're really concerned, go ahead and get a PCR test, and I would go to one of the call around. You can probably, I'm sure one of the urgent cares do them, and they can run the test for you, and then you'll get a more accurate look as to whether or not you actually have COVID. But if you start developing symptoms, of course, you do your home test. But if you're not and you're still concerned, that's what I would do.
Thanks, Kim, for the call. We really appreciate it. If you're just joining us, we're talking about the Omicron variant of COVID-19 with cardiologist and health equity director for Sentara, Dr. Keith Newby. 440-2665 or 1-800-940-2240. Let's go to Elsie in Newport News. Hi, Elsie. You're on the air.
Hi. Sending good holiday wishes to everyone.
Thank you.
I have a question for the doctor about determining mask quality. There's a million masks out there now. People are making them. They're all over the web, every store. But and I was doing research on the 95s and the K95s, the N95s and the K95s, trying to figure out the difference. And what I want to know is, it appears the KN95s are the Chinese version of the 95s and don't meet all of the U.S. standards. But when you're shopping around for them, how can you tell whether you're getting a true 95 or a ripoff?
It's kind of hard to really tell that. I tell you what, I think you look at the reputation of the company you're getting it from. And, the one thing about it is you can run, but you can't hide on the Internet. So, if you kind of start really looking and reviewing that particular company's mask, but unlike last year, or I think whenever this first started.
2020.
2020. I mean, the masks were hard to come by. I mean, it was a struggle trying to get them then. I mean, now it's not a struggle anymore. And I'll be honest with you. I mean, I don't wear an N95 that much. I wear a surgical mask, and you look at a lot of the data. Surgical masks are pretty good because it's kind of interesting. You'll find Barbara probably doesn't notice this with me because I know we don't actually hang out like we did before all this. But I never hang around anybody but so long. You'll see I'm always moving. So I come like when I'm seeing patients in the room, I go talk to them, and then I immediately move to the other side of the room, and I do this very smoothly. So, and I'm just doing like we're just talking, but I'm never around anybody up close and personal, but for a few seconds. You a minute or more when I'm trying to listen to them, make sure I hear all I need to hear. Then I immediately go back to my station. So I do all that so that I'm not in that person's physical space, but so long. So the surgical masks are actually not bad, but to me, the K95, N95. If they are most of them meet enough of the standard that it will protect you. So I haven't heard anything to the contrary personally about the K95s being a negative kind of situation. They may not meet all the U.S. criteria, but that doesn't mean they're not effective. That just means whatever additional criteria that the U.S. may have, and we don't know all the dynamics of that, that may play some role, but I still think when I did my research, the surgical masks were pretty effective, So to me, if they are, then the K95 should be just as effective. Just kind of look up that company's reputation before you buy.
Okay. Thank you, Elsie, for the call. Yeah, go ahead.
Oh,
you have
can I
one
just
more?
piggyback one more question?
Sure. Uh-huh.
On that, somebody, this may be hearsay, somebody said when you're checking masks for, regular masks or surgical masks, cloth masks, if you can blow out a candle, don't use that mask. If you can't blow out a candle, that's a pretty good indicator.
I never heard anything about that before, but I understand their point, because of the ventilation of that mask. But you got to have some ventilation. But it is, I think, true to a large degree. But I think what I would do is wouldn't look at that as a criteria. What I would do is look at the actual, look up that particular mask and their effectiveness. If you do that, that's going to give you more surety than what you're saying. But I understand that point, because if you can blow out a candle, that means you get
that means things can flow back
the
in.
air is just going right on through. Anything going out can come back in.
Yeah.
So that piece I do get. But I would say this: I think look up the mask, look up the quality of the mask, and say. And a lot of times you can look up what mask would protect me from COVID-19, and they will tell you the quality of the mask that you need to make sure you're protecting yourself.
Okay. Thank you, Elsie, for the call. We really appreciate that. 440-2665 or 1-800-940-2240. Let's talk to Steve in Suffolk. Hi, Steve. You're on the air.
Hi. Happy holidays, everybody.
Happy holidays.
Thank you. I have a question for the doctor about masks in cars. You see people with masks, wearing their masks while they're in their cars, and I think that's kind of scary and dangerous to me, because if you've got the initial symptoms, that you're exhaling those and then just re-inhaling whatever viral particles. So has there been any studies on that? And I'm all for wearing masks when I'm around other people, but as soon as I'm out of that store, I'm taking that thing off, because I don't want to be getting whatever it is.
Yeah. Well, I'm like you.
I do
to be honest with you, once I get out the store, a mask comes off. Because if you look at the data when they talk about like in crowds, or like if you're in an outside event, depending on the number of people you have and all that, I'm always, again, I tend to avoid a lot of excess communing with people when I'm outside. But, to me personally, I've not seen any data about being in cars. But when that mask comes off, once I get out that store, the mask is coming off.
And you're in the car by yourself.
Yes.
Most of the time when you do that, right?
I am. I don't know about the caller, but I know I am. I may have my daughter with me. at times, but or my wife. It depends on what's going on and where we're going. But most of probably 9% of the time I'm by myself.
Gotcha. Thanks, Steve, for the call.
And they have some cars that have my car actually has has a filter for pathogens. I don't know how really good it is, but I know it said it was designed to say if we had some chemical warfare outside, and I have a serious HEPA filter that can filter out everything in my car. So but I'm not. I really don't think that's necessary. But I really think that you probably would do fine just taking a mask off when you're in the car.
So the key about masking is when you are in close proximity to people and have people around you and you're indoors.
Yeah,
that's when you want to keep your mask on, right? Okay.
Exactly, because you think about because you're outside, particles. They can go anywhere. They're all up in the air. There's nothing enclosed when you're outside.
Right.
When you're inside, then those things can hang around because, again, depending on the ventilation in the room you're in, impact the ability to transmit that virus.
Okay. Let's talk to Bernita in Williamsburg. Bernita, correct?
Yes.
Hi, how are you? You're on the air.
Good, man.
Good.
Okay, I have a rather complicated question. I don't know that there's been established whether we need to take the vaccine annually or not. And that's what I'm wondering, because I took the vaccines in March and April of last year, both of them. Then I got COVID in October. I'm pretty much recovered now, but I'm getting ready to take the booster. So between the time I take the booster and the time I got my 2 vaccines last year will be 3 and 4 months. I'm wondering whether I should take another main vaccine in March and April like I did last year.
Well, let me ask you this: you had you had one of the Moderna or the Pfizer?
Bernita, are you with us?
Yes, I had the Pfizer.
Pfizer?
Okay, Pfizer. And after your second shot, your third shot came how soon after the second one?
I didn't take a third shot. I just had the second one.
Okay.
Yeah, she got COVID in October.
COVID.
Yeah.
6
How
months
long
later.
after?
6 months
6 months
later.
later.
Okay. Yeah, that's about the time that they were seeing the decline. See, the one thing with the Pfizer, I had Pfizer myself at the time that I had mine. That was the only thing that was available when I first started my vaccination. If you look at some of the data on when the antibody response was tapering off, Pfizer had a less robust response, so it was falling off at 4 months. If you look at a lot of the data that came out post-vaccine. Moderna had a little better profile because the amount of actual vaccine that was being delivered, meaning say when you get that 0.5 cc shot, the actual amount was more robust in the Moderna, which is why their antibody response was higher. So you fell in a window where I'm not surprised, and I tell people all the time, a lot of people are thinking vaccines are supposed to be 100%. There's no such thing. That's almost like getting an antibiotic for a UTI, urinary tract infection, and the antibiotic doesn't work. There are some bugs that just not going to work against that antibiotic. So there's no such thing as 100% anything in life. I think that when you compare the two, meaning compare being vaccinated or being unvaccinated, there's no question that being vaccinated protects you more than being unvaccinated.
Yeah, but she's asking you, though, also, Dr. Newby, is because she got COVID in October, now she's ready to get her booster, and she's saying, do you think she'll have to get another booster back in March and April again? So in other words, a yearly dosage.
No, well, we don't know that yet.
Okay.
I'm sorry. I totally missed the boat on that question. We don't know that yet. I won't be shocked if we have to get yearly boosters for a while at least, because unfortunately because we've never reached herd immunity because people, don't want to get vaccinated. So until that comes about, I think we're still going to be in a position where, there's going to be exposure risks. So to answer the question, we don't know, but I won't be surprised at all. The only thing I'm hoping that the FDA does or the CDC is, to me, stop messing around and just put the criteria out there and let's just make it happen. All the flipping, to me, 1 minute is this, 1 minute is that. I think that's what creates the less than desirable outcome, or that you want to hear people say, I'm vigilant, that I want to get vaccinated. If you're always changing things, people start to lose confidence. So I think if the criteria is going to be that we need yearly shots, at least for right now, I would say just say it and let's keep it moving.
Yeah. So, Bernita, go ahead and get your booster,
Yes,
and we hope that you stay COVID-free this time.
Yeah, me too. Thank you.
Thank you so much for the call. We appreciate it. So let me ask you, Dr. Newby, so the other question out there is the flu. Because, everybody's worried about COVID, but the flu is running rampant also. And my understanding is that it's hitting pretty hard. So should people be getting their flu shots too?
Most definitely, because this is the difference. Remember last year, you didn't hear that much about the flu last year.
Right.
You know why? Because people were wearing masks last year.
Mm-hmm.
People not wearing masks like they did last year. So hence, the flu bugs are going to be more because, again, as we get in colder months, you're going to be inside and you're going to have the chance of transmitting things. So to me, and then the last thing you want is to get the flu and then get COVID on top of that. Because every infection you get is going to blunt your immune response for that period of time because, you have to recover. So your immune response is going to dip down. Look at it almost like when you get the chemotherapy for cancer. The chemotherapy is designed to, knock out your immune system because it's trying to prevent the cancer from growing. So it's going to knock stuff out for a while. And then your body recovers and you start to, get stronger. Look at a flu bug, is going to take you down for a while. So then your immune response is going to be blunted because you're already fighting this one flu bug. Then on top of that, if you get exposed to COVID, that's a double whammy. Why take that risk? I've had my flu shot. I'm telling you, I am not catching anything that I don't have to catch.
And how much distance should you put between your booster and your flu shot?
I'll be honest with you. I personally, and this is just me personally, this is anecdotal. This is not, no data support this. A lot of pharmacies are doing them at the same time. I'm not a big fan of that, and I'll tell you why. The rare chance you may develop a reaction, what did you react to?
Yeah.
You don't know because you got 2 shots. So then it's like, okay, well, I think I may have had allergic reaction to the flu shot, but I don't know. It could have been a COVID shot. I don't know. So why do that? I have been I've been encouraging 2 weeks between. That's me personally.
Okay.
That's anecdotal. There's nothing to say you can't get them both at the same time. Nothing out there that says that. But I'm looking at, I'm that what if kind of guy, and I'm just thinking of how do I deal with the what ifs that somebody has a reaction because they had 2 shots. I don't know what they reacted to. So I'm recommending 2 weeks personally.
So you are a cardiologist. And how do you respond to people who say, you're a cardiologist, you're supposed to be about taking care of people's hearts. Why are you so concerned about COVID and about getting vaccinated?
Well, 2 things. Firstly, I'm a doctor first, a cardiologist second. When I took my oath, I wasn't a cardiologist then. I got my medical license, I got my medical degree, and I had to go through internal medicine before I went into cardiology. So that's the first thing. Second thing is because my people are dying. That's why I care. Yeah. So those 2 things, and I read. So I'm not an infectious disease specialist. Those guys, they go through their process just like I go through mine with cardiology. But there are a lot of people in infectious disease that know certain things about cardiology, and cardiology know things about infectious disease. It's a matter of reading, and I read because I want to learn and I want to understand because people ask me my advice. I have to give them my advice based on facts and data, not supposition or this is just my gut feeling. I try my best, and I caveat. You notice I caveated it when I said about the flu shot and the COVID at the same time. I said it's anecdotal. I said I can't say, and people that know me know I will always say either I have data to support with my position or I don't. But if I have it, I'm going to speak it as this fact based on the current data that we have at our disposal. So I'm a doctor first, cardiologist second.
Gotcha.
But I care about my people most.
Yeah. And another question about the vaccines, if this whole idea of mixing the vaccines. So if you got Pfizer first, can you get the Moderna booster? Should you stick with the same thing?
At this stage, I would say get what you can get.
Okay.
And I'll be honest with you, I never really, I knew kind of why they were didn't want to mix them at first, but it never made sense to me because I'm like, if they're both in the same vein, because really all of them are targeting the same thing, which is the spike protein. They're all doing that. The Moderna, the Pfizer is targeting the same spike protein. The Johnson & Johnson is targeting the same spike protein. There's just the delivery model is different. That's a vector delivery versus a straight messenger RNA vaccine. So they're all targeting the exact same part of the viral molecule.
So the bottom line is just get your shot.
Yeah, get your shot. And wherever you can get it, I say just get it. And now if you say, is there one that's better? I can't say that there's one that's better. They have differences. There are some salient differences between all three. But the effectiveness that you need, because even like with the Johnson & Johnson, it's kind of interesting. I think they were trying to sell themselves as a one-shot deal, and that's why they kind of came out the way they did. But when they actually did the data looking at their effectiveness, when they studied 2 shots versus 1, it was exactly the same as the other ones in terms of effectiveness. I think they were just trying to sell themselves as a one-shot deal for obvious reasons. But I think that when you look at effectiveness, I think they're all the same. I don't look at it. I think the young lady earlier mentioned about lab rats. I mean, again, I want to make sure people understand you're not a lab rat, because the data had already been done prior to getting emergency authorization use.
That's the piece that people don't understand. It had to go through its
studies first. And I want to make sure people understand that, and then people then will say to me, like, it came out too fast. And I'm like, well, define too fast. I mean, we had people dying. You saw the number 800,000 people. How long do you want to wait before you come out with something? So I was itching to get my vaccine. I mean, I got mine December of last year, my first one. I was itching to get it. I was like, whoever is going to give it to me, I was fighting to get it. I mean, because I'm not trying to catch this stuff. So I'm like, give me the shot.
Dr. Newby, you know what? We got to say goodbye, but we want to say Merry Christmas, Happy New Year. I got to dump you. I got to let you get back to your patients. Absolutely. But I truly appreciate you spending the time and making some things clear for us.
Hopefully we make a difference, Barbara.
Absolutely.
You and I, we're going to keep pushing this.
We're going to keep pushing it. Absolutely. Thank you so much. That's Dr. Keith Newby. He's a cardiologist and the Director of Health Equity for Sentara, and we'll be right back.
Hi, this is Essie Patha-Murkerson from Law and Order. You are listening to Another View.
Thank you, Todd. I appreciate that. This little fact should make you think. Close to 90 million Americans are at risk for preventative health problems due to low health literacy. Because what you don't know could kill you. Fortunately, there's a free program available to help folks here in Hampton Roads increase our knowledge when it comes to our health. It's called Healthier 757. Our Lisa Godley gives us an inside look at this interactive program where the more you learn, the more you could earn.
Once I logged in at rewardsforhealthyliving.com and registered, it was up to me to decide which health topics I wanted to learn more about. There were plenty to choose from: cold and flu, sleep health, urgent care versus the ER. I decided to start with coronavirus. After almost 2 years of researching the topic, I thought I'd breeze through it. Well, I did pretty good for a while, and then I didn't. Let's see. COVID-19 is, I've got 4 choices: the official name of a novel coronavirus, a drug used to treat the coronavirus, the name of the coronavirus test, a disease caused by a novel coronavirus. I'm going to go with the official name. Nope. It's a disease caused by a type of coronavirus. I didn't get any points there, but I'm learning. And while I try to redeem the points I missed out on, I'd like to introduce you to Tom Chamberlain, the founder and CEO of EdLogix, the company that developed the platform for Healthier 757. He says it all began as a service his company provided business owners to help their employees become more health conscious and subsequently better decision makers when it came to their health choices. The result was healthier, more productive workers.
By improving health literacy, that has a positive impact on economic prosperity. Having smarter individuals in the 757 region makes it for a better region for employers, for maintaining and controlling healthcare costs, whether it's an individual out of pocket or whether it's an organization that's paying for healthcare services. And we thought that it was important that we make this available to the community as a free service by aligning with a nonprofit organization. So it's funded through philanthropy and foundations, but we've always had as a focus improving the health of individuals in the community, and that starts with improving health literacy.
There's lots to learn, from easy stress busters to understanding your medications.
We have over 80 healthcare topics ranging from diabetes and heart disease and coronavirus to mental health, how to navigate the healthcare system. So it's very easy to sign up through rewardsforhealthyliving.com. And once you're in, it's very easy to navigate and identify what areas you have interest in. We've found through focus groups and other market research that there has to be an incentive to really get people to engage. So we wanted to make the platform rewarding as an individual by improving their health, but there has to be some extrinsic rewards like cash and other prizes. And as you engage in that platform through fun, interactive health games, there's points and badges, and there's a leaderboard. And the more you engage in the platform, the higher up the leaderboard you go, and the greater your odds are of winning cash prizes and other merchant-funded rewards.
Starting in January, Healthier 757 will kick off a campaign focusing on mental health. He says while the information they share is for everyone, their main focus is on individuals at a higher risk for low health literacy and chronic conditions like diabetes, cancer, and heart disease.
We're working with organizations that have access to those at-risk populations and going in and really trying to make a difference in their lives, and even working with physicians in the community that treat a lot of those patients, trying to get them to prescribe education and introducing the platform to their patients.
If you'd like to test your health knowledge on a particular topic or simply want to learn more, you can log on to rewardsforhealthyliving.com. For Another View, I'm Lisa Godley.
And that's rewardsforhealthyliving.com. Thank you so much for joining us today. Do me a favor and please share this show with a friend. Visit anotherviewradio.org and you can download the podcast. And while you're there, please sign up for our eView newsletter. It's a once-a-week reminder of upcoming shows. We're up over 200. We're rebuilding our database because we lost our entire database. So it's a slow crawl, but we can get there one person at a time. So please register for our eView newsletter at anotherviewradio.org. So the Another View crew is taking some time off for the holidays. This is our last live broadcast of 2021. What a year it has been. We thank you so much for your support during this year and every year that we have been on the air. You know, Another View has been on the air for 11 years. And so we are very, very proud of that. We so appreciate you, our listeners. Our theme music is an original composition made especially for Another View by Jay Sennett. Lisa Godley is our show producer. Todd Washburn is our audio engineer, and Dr. Barry Graham answered our phones. On behalf of Lisa, Todd, and Barry, I'm Barbara Ham Lee, wishing you and yours the very best this holiday season and a joyful and prosperous new year. We'll be back again with you live on January 6th, 2022. Thank you so much for listening to Another View.
Support comes from Thomas Nelson Community College, now becoming Virginia Peninsula Community College, the first choice to start a bachelor's degree since tuition is 1/3 the cost of four-year schools. More at tncc.edu.
Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever, whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.